Hi, I'm Dr. Len Saputo, and I'm here with Dr. Meir Schneider. Meir Schneider is a licensed massage therapist, but above that, he's got an honorary PhD in the healing arts. He's the founder of the Self Healing Research Center and also the School for Self Healing in San Francisco. He's the author of several books, including Movement for Self Healing, which is what the topic is going to be of this discussion. He's also the author of another book that he's just come out with. It's called Vision for Life, which has practical ways that you can look at how to help your eyes without doing things that are aggressive. So you wrote this book, Movement for Self-Healing,
I
Meir.
did.
What
You
did
know, the original book was Self-Healing My Life in Vision.
Mm-hmm.
And it sold beautifully for 13 years. And
Yes,
when the
it's a great book. I read it
when
myself.
Penguin took it out of print, I went to another publisher, New World Library,
Oh, yeah.
and they wanted me to add something. So the Self-Healing My Life in Vision is in Movement for Self-Healing.
I see. Okay.
And to add to that, we add more exercises.
Okay. So what is it with movement and vision? What's the connection?
Very good question. You know, when I started to work on my eyes, basically 99% of my lens being scar tissue, 1% lens allows the light to go through. Basically, I had 1% vision. Now I have more than 70% vision. So I asked myself the question, my structure have shown that I should never be able to see, and yet I learned to enroll powers in my brain and other parts of my visual system to see. Can I translate that to other situations, to other conditions? And I learned that actually I could. The body has 600 muscles, and most people use only 50 out of them.
That sounds right.
And I'm so happy to be on in your place, in your clinic, and in your show, Len, because Dr. Saputo is an open-minded physician. Most physicians don't understand that. We only use 50 out of 600 muscles, and most of our muscles are dormant. And so if somebody comes to me and they're half paralyzed, I often can get them out of paralysis learning to use muscles they never used before.
It's sort of like we use 10% of our brain. Sometimes we don't use it at all.
Right.
Right.
Now, most of the back problems and back injuries are a result of not using most of the muscles that are available for us. Just yesterday, I worked on one woman who came to me with a shoulder pain. Yeah? But I discovered that actually the biggest problem was that she was very, very tense in the gluteus medius, in the side of her leg. And the side of her leg is what stabilizes the whole walk. You know, she was unstable. She, in fact, after that even slid and fell going down the stairs.
Gee.
Shoulder pain is a result of that. Back pain is a result of that. Let's learn to use muscles we never used before. For example, run backwards, run sideways. Don't just walk forwards. Lift your legs as high as possible. Our massage, in combination with movement, leads to changes that are unbelievable in people's bodies. One story that I have is that once I had a frozen shoulder. It was a result of an accident. A driver hit me, a hit and run, and some people took his license number. It was interesting how the police wasn't interested. Just wrote to me, here's his name, here's his insurance.
Yeah, right.
But anyway, what I did is for a year, I was trying all kinds of treatments, chiropractic, all this. One time, in Brazil, actually, when I was teaching, I lied on a single bed. I normally have a king-size bed in my home. And I put my foot on my thigh, and I lifted my knee. Most people can't do it when they lie on the stomach. It takes a little real work. So I build up my abductors, the ones that move the leg to the side, and my gluteus medius, which is a very important muscle that support the back. Well, guess what? Right after that, I lifted my arm as if nothing was wrong with it. And
Wow.
almost always in massage conferences, I show to people that if you strengthen the gluteus, you help the arms. If you strengthen the back of the legs, you help the back. I think
It's all connected, isn't it?
99% of our back problems, hip problems, should not even be here. All the joints are interconnected. There's no way that you're going to lose your hip joint if you strengthen your toes.
That's amazing.
Because the toes are connected to the ankles are connected to the knees are connected to the hips.
So you exercise at
So
all.
most people are just looking at the hips. The hips are connected to the lower back. And if you want to improve your digestion, may as well have loose lower back. The lower back connects to the middle back. The middle back connects to the upper, to the neck and to the jaw. So dentists will take from you $60,000 to do all kinds of jaw work, when actually the problem starts in your toes.
That's so right.
Unbelievable, right?
Not really. I mean, when you think about it, you think holistically, you think integratively, and you know that all the things that the body is doing are interconnected.
Absolutely.
It's like the knee bone is connected to the ham bone or the thigh bone and all that.
There's
That
no
song was
question.
right on the mark.
And it's all in the brain.
Yeah.
And the brain, you see, the brain understands that if you don't have strong legs, there's no support for the upper body. And so,
So it compensates.
a person comes and says, I have a back pain, that's what I want you to work on. I want them to work on the total movement of the body. So
Sure.
in our school, we have free classes now and then, but we have also long classes, there are paid classes, and people come and study through a full training of how to work on the body and how to make sense out of all of it. I didn't have a person who came to me with back pain and left with back pain. It didn't happen. As long as they stuck enough to their exercises, to the therapy, they always got rid of the back pain. I didn't have a person who came to me with arthritis and it in any way continued. Because you can stop arthritis. But look what happens when people take medications.
Oh, sure. It suppresses everything.
There are more people who are dead from anti-arthritic medication than from all illegal drugs put together.
More deaths from that than almost anything else. There are 400,000 deaths every year, Mayor, from the use of medications that are used properly and improperly. It's an amazing number.
400,000.
400,000 a year. So when we look at our orthopedists, they frequently are doing lots of operations. They're doing hips and knees and necks and backs. And they don't know what you're talking about, or they don't focus on it because their job is what? It's to fix the problems. And a lot of the time, by the time the patient goes to that person, they probably need a hip replacement or a knee replacement because it's totally shot.
Right.
But if they had thought, oh, what about that TMJ problem that led to neck pain, that led to back pain, that made the knee go out, now they have a knee replacement. They don't study that.
Exactly. And let's say that you're uncomfortable sitting in front of the computer and looking at it all the time. So then your boss gets you a very nice ergonomic chair. So you're good for about 2 or 3 months, and then you become uncomfortable with that chair.
Exactly.
Then he gives you a class of stretches. He tries to take care of his employees. But you know, it only helps for a while, and then eventually you do a surgery. Here is what
right.
has to be done. Find the muscles you never knew you had. Discover them. Work with them. If you get my book, Movement for Self-Healing, if you get any of our tapes, if you work with us, and you can definitely look at our website at www.self-healing.org, as is being linked to this website, you will find so many solutions to common problems that shouldn't even be here. Again, I would like to apologize. There are many bad things about me, and one of the worst things, I never have back pain. And I feel very lonely because most people do. And I should have back pain because I fly all over the world. Flying to Israel is a long trip. Flying to Brazil is a long trip. Even flying to England is a long trip.
Sure.
I do it all the time.
Yeah.
I do it like 3 or 4 times a year to every one of those countries. To middle of Europe. I don't have back pain. In spite of the fact that the chairs in the airplane are made for people who don't have ankles, knees, or hips. So I'm doing that without back pain because I work on the rest of my joints.
So what we want to take home here, here's our closing message. There's a lot you can do to preserve your health, particularly in the neuromuscular system and the skeletal system, if you exercise properly and you don't use up your reserves in a way where you're unbalanced. You need to do, if you're a tennis player, for example, you should probably swim to fix the other
Absolutely.
Or maybe if you're a track star, run backwards. All these kinds of
And
things.
crawl on the beach.
Exactly. So there's a lot to movement for self-healing that can do a lot. And I'm suggesting, again, here's a good book that can teach you something. Thanks, Mayor.
Thank you. Len, your turn.